Hello everyone. This is a continuation of the last video on law and medicine. In the last video, we had discussed health as a basic right. We have also discussed that health is a subject also of human rights because everyone, every human being, every individual is endowed with human rights. And health is one such thing that cannot be snatched away or taken away by any human being. Right? We also discussed that it is the duty of a state, it is an obligation of a state to protect the health of each and every individual. We also discussed, various international conventions. And now today in this video, we are going to discuss the Indian position as to right to health. So coming to this slide, see, we all know that, World Health Organization, it says that health is a state of complete physical, mental and social well-being of a person, right? And not only absence of disease. It means that, a person who is not having any disease doesn't mean that, he has a complete state of physical, mental and social well-being. So in order to have a proper health, one should have all these factors: physical, mental and social well-being, as well as free from the disease, right? So in India, what is the scenario? What is the status of health? Now see, when we talk about, you know, uh, our Constitution of India. So the Constitution of India, it has in various places discussed about right to health, as a fundamental right. Also in directive principles of state policy, the various and multiple facets related to health are being provided by the Constitution of India. We'll discuss in the coming slides all these details related to the Constitution of India. Before that, please try to understand that health is also a matter of, you know, state list in the seventh schedule of the Constitution. That means at present, health falls under the state list. Okay. Now, what happens in 2019? There was a high level group that was set up under the 15th Financial Constitution, Finance Constitution. And this 15th Finance Constitution, it recommended that, right to health should be declared a fundamental right. And it also recommended that the subject matter of health should be moved from the state list to the concurrent list of the Constitution. See, when we will discuss health as a, right to health as a fundamental right, then we will see that, the Constitution of India is not expressly declaring right to health as a fundamental right. Rather, through, judicial decisions, this right to health has been read into fundamental right, especially under Article 21 of the Constitution of India. Okay. Now see, health, right to health also means, accessibility, affordability, right? To maybe, for example, clean drinking water, sanitization, right? Cleanliness around, clean environment also, right? Promotion of family welfare. All these things, are included in the right to health. Now see, India, it is a party to various international conventions, right? World Health Organization and all the conventions, various conventions that we have already discussed and covered in our previous video. See, what happened in 2019, Niti Ayog, okay, it published a report on healthy states, progressive India. Basically, it was a report on the ranks of states and union territories. Okay. In that report, Niti Ayog recommended that, health is a critical area and a lot of improvement is needed in that particular area of health. right? States, you know, some states have very good healthcare system, and some states or union territories do not have, a very good healthcare system. It means that, there is a disparity in states when it comes to health services, right? Allocation of health services, accessibility of health services. So there is a lot of disparity and differences when we talks about the states and the union territories, right? See, when I was talking to you that health is a, subject matter of state under the seventh list of the Constitution. See, if it is transferred to the concurrent list, then there are various academicians and scholars who suggest that this will strengthen the public access, right? There will be centralization of public health. It will give more benefits to people. This disparity, it will be, narrowed down, the provisions with respect to health services, right? All the disparities and discriminations will be lessened. But on the other hand, there are also various, academicians and scholars who say that, if centralization of public health is done, then, because every state has, their own demands, so that will not be fulfilled. Also, there are lack of financial, you know finances, lack of financial constraint is there, right? Lack of technology is there. So, all these recommendations and critical analysis has been done by various academician scholars, right? But the health, right? The services related to health should be equitable to everyone. They should be equitably provided to each and everyone present in the society, right? There should be no discrimination based on sex, based on race, creed, color, right? Gender, rich or poor. That divide should not be there. Now, see, as I have already told you that India is a party to various international conventions like World Health Organization, right? Universal Declaration on Human Rights, World Health Organization Indicatory Metadata Registry, right? This sets out specific indicators for the most elevated achievement of guidelines which guarantees right to health. And therefore, India should try to come up with, better health services for each and every human being, right? Now, see, this Niti Ayog report, Niti Ayog has also launched, health index. And as I said, several states have made really good progress towards achieving, we can say sustainable development goals also. For example, Kerala, Tamil Nadu, right? And, there are various other states, for example, Maharashtra, Punjab, they are close to achieve their target, right? So every state is working in a different manner, and that is why there is disparity in public health system. All right. Now see, we also have rural health statistics of 2019 and 20, right? These rural health statistics of 2019-20 were released by Ministry of Health and Family, and it says that, the report says that there's a shortfall of surgeons, physicians, gynecologists, and especially in rural areas. Okay, if we look about, you know if we look at the union budget of 2021 and 2022, public health expenditure is just 1.2% of GDP. And the economic survey, it has also recommended that, there should be increase in public health. 2.5% to 3% of GDP should be, given for the public health expenditure. And India being party to so many various international conventions, for like examples I have already given you. The WHO norms, they says that, there should be 5 beds per 1,000 population. And India, we have only mere zero point 0.5 beds for every 1,000 population, right? So, uh, we all know what happened when we were facing the pandemic COVID-19 situation. There was lack of beds for people, lack of oxygen, right? So many people died because of, they were not getting proper health uh, services, proper doctors, proper clinics. They did not get bed facilities, oxygen at proper time, the time when they needed it, right? So many people lost their lives because we as a country, somewhere or the other, we were not prepared for the pandemic situation, right? So all these, the recommendations, the Niti Aayog report, rural health statistics, all these reports must be given, a serious look, and the requirements related to health services should be fulfilled, right? Because right to health is, a person's right, a right to remain healthy. It empowers the citizens, right? The 15 Finance Commission in 2000, of 2021 and 2026, in its report it said that there is shortage of, trained nurses. The nurse to population ratio is 1 is to 670, and that, is against the WHO norm of 1 is to 300, right? And the highest shortage of trained nurses is in Bihar, Jharkhand, Sikkim, Uttar Pradesh, Uttarakhand. All right. So, lot of work has to be done when it comes to health services. Now, see, there are various schemes, initiatives that has been taken by the government of India, like Ayushman Bharat, that is Pradhan Mantri Jan Arogya Yojana, right? It provides health cover of rupees 5 lakh per family per year of hospitalization to the poor, right? We have Janani Shishu Suraksha Karyakram, right? This scheme is under National Health Mission, right? Maternal, services are provided easily. Accessibility and affordability of, maternity services are provided under this scheme. We have National Health Mission Free Drug Service Initiative. It is, an initiative taken so that, essential drugs are made available at free of cost. Then we have Surakshit Matritva Ashvasan. This scheme, this initiative provides assured, to dignified, respectful, quality healthcare services to everyone in the society. Right? Health is wealth. We all have heard this. If health is, not good, then people will not be empowered. They will not be able to carry out with their day-to-day basic activities. Right? They will not be, fulfilling the needs of their own families, of their own self, right? So also this COVID-19, it was a wake up call, it was an alarm bell for universal access to health in the country, right? There is also an initiative by Amitabh Bachchan. He's a campaign ambassador of Banega Swachh India, right? And this initiative, it is talking about interdependency of humans and the environment, humans on one another, and the focus is on one health, one planet, one future, leaving no one behind. So lastly, health is wealth, and everyone should take proper health, proper care of their health, right? It is a duty of the citizens also, right? Proper sanitation, proper cleanliness around them should be there. Now see, what does the Indian constitution talks about right to health? This we are going to cover in the next video, right? We will see that right to health, it is protected under various ways, article 21, article 39, and so on. We will also see some important landmark judgments and latest case laws. So keep watching the upcoming video. Thank you so much.